So what's the best Medicare supplement or Medigap plan that you can get in 2023? Well, we get asked this question all the time here at Agape Insurance and Financial Group. And by the way, Rob here, also known as the Medicare Minister. And today I'm going to answer this question for you because many people are confused, overwhelmed about Medicare and just don't know which direction to go. And so today I'm going to talk about the best Medicare supplement plans. And if you look here on the chart or on the screen, I have put the plan comparisons from Plan A to Plan N, and I'm not going to get lost in the weeds here and dive deep into every single plan because the two most popular plans currently and for the past couple of years has been the Plan G, which you see right here on the screen, and then all the way over to the far right is the Plan N. Now I'm going to talk a little bit about the Plan F because maybe some of you have heard a friend talk about the Plan F or maybe a family member talk about the Plan F, or just an acquaintance say, I have that Plan F, that's the Cadillac plan. That's the one that you want to be on. Well, later on in the video, I'm going to talk about why the Plan F is no longer available. And so the bottom line is this: you need a Medicare supplement, or the fancier term now is Medigap plan, to help shield you against some deductibles and that co-insurance that's left over from Medicare. And to me, this is the best way to go, simply from the fact that it's the most comprehensive, or I like to call it full coverage insurance. And so time out real quickly, I just want to make a side note. There's a lot of videos on YouTube and on the internet and different articles. You see people bashing Medicare Advantage plans or Part C plans on the internet. And here's the bottom line with that. A Part C or Medicare Advantage plan can be a bad plan for you if you do not know what you're getting into. But over the years, many of our clients that we've worked with, that's really all they can afford. So when I get asked, which direction should I go? It really depends on your budget, and it really depends on your personal healthcare needs. All right, let's get back to our regular scheduled programming. So what's the best Medicare supplement plan? Well, that's really a tough question to answer because it's really going to depend on your specific needs. So why do we need a Medicare supplement? Well, when we look at Medicare Part A, there is a deductible of $1,600. In other words, if I go inpatient in the hospital today, I could, or actually I will be charged this $1,600. And you can see the little chart here. It says days 1 through 60, inpatient hospital stay days, $1,600. And then I have doctors Part B of a 20% co-insurance. So one of the main reasons we want to look at a Medigap plan, or make sure that we have the right Medigap plan or Medicare supplement plan, is because of this particular deductible of $1,600. And then my Medicare is only going to pay 80%, and it's going to leave me with 20% that's left over. And here's the scary thing: that 20% is uncapped. There's no limit to it. And then excess charges are just simply that Medicare says this is the amount that you can charge, but the doctor is allowed to charge up to 15% more than the Medicare allowed amount. Okay, that happens very rarely, but there are some Medicare supplement or Medigap plans that do not cover excess charges. And you see here, 90-day hospital stay days, 61 through 90, you pay $400 for each day. Okay, so $1,600 for the first 60 days, 61 through 90, you pay $400. And that's where it really starts to get scary if you do not have a Medigap or a Medicare supplement plan in place. Now let's look at Part B real quickly. The Part B deductible for this year, you see it here in yellow, is $226. That means this is my responsibility on an annual basis to pay this before my Medicare will pay anything, right? My Part B will kick in. And then the premium for 2023, I have a little chart here. Most people are going to be in this top category of the $164.90. Now, side note, I get asked all the time, well, how do I know if I'm going to be in that top category? Well, in all of my years of doing Medicare, 90 to 95% of the people that I have worked with have been in that top category. If you want some more information on this, either my number will be on the screen or in the video description. You're more than welcome to reach out to myself or one of my seasoned advisors at no cost to you, no obligation, and we'd be more than happy to help you review all of that. But most people are going to be in that 164.90. Now, the reason I'm showing you this Part A and this Part B is because I want to show you the need for a Medicare Supplement or Medigap plan. Okay, so let me go down here and talk about the Medicare Plan F real quickly. The Medicare Access and Chip Reauthorization Act, or MACRA for short, is a law that changed Medicare supplement plans in all states, and it became effective on January the 1st, 2020. Now, I just want to give you the short version when it comes to Plan F. You can read it on the screen for yourself if you want to, but the short version is if you qualified for Medicare on January the 1st, 2020 going forward, you can no longer get the Plan F. And the Plan F is what I call the Cadillac plan. Basically, I would give them my red, white, and blue Medicare card. I would give them my Plan F supplement card, and I never paid anything. It covered all the deductibles. It covered the 20% that was left over. And so you would walk in and you would walk out, so to speak. Well, the Plan F is no longer available to those who qualified for Medicare on January the 1st, 2020 going forward. If you were on Medicare or qualified for Medicare before that date, you can still get the Plan F, all right, the Cadillac plan. January 1st, 2020, going forward, you cannot access the Plan F. And so the new Cadillac plan, if you will, is the Plan G. That is the most popular plan that we see in the different states that we work in, is the Plan G. So what's the difference between the Plan F and the Plan G? There's really one main difference besides premium, because the Plan F was the highest premium plans. The Plan G is a step below that when it comes to your premium, which means you'll just pay a lower premium, but now you're responsible for that $226. Let me scroll back up here real quickly. If you remember, the annual deductible for this year is $226. So the main difference, besides the lower premium amount with a Plan G, is the $226 deductible. It covers that Part A deductible that we talked about early in the video, and it covers that full 20% that's left over that Medicare Part B doesn't cover. All right, so the most popular plan, the new Cadillac plan, is the Plan G. Now, before I talk about the Plan N real quickly, I just want to stop here and say this. If you're getting value from this video, please take a moment to like it. Give us a comment, give us some feedback if there's some other questions that you have. Turn on your notifications because I want you to be notified every time we drop fresh content like this. And maybe share this with some friends or somebody you go to church with or some acquaintances or whoever's in your circle, because maybe they're confused and don't know what the best supplement plan is for them. All right, so before I talk about the Plan N, real quickly, I want to make this very clear when it comes to Medicare supplement plans. I get people that call me on the phone or come into my office all the time, and they'll tell me they want a specific company name branded Medicare supplement. Nothing wrong with that, but because I'm a broker advisor, I work pretty much with all the different companies. And so I always like to give them this statement: a Medicare supplement Plan G or Plan N or Plan whatever is the same, has the same benefits as a Medicare supplement with a different company. In other words, and I'll just use some examples, I may get someone that comes in here and says, I want that United Healthcare AARP Plan G. And they go, that's the best one. My family told me, or my friends told me it pays really good. Well, friends, because Medicare regulates it and standardizes all these plans, they all have to pay the exact same way. So you never want to pay more for a plan with company A than you would with company B just because of the name. I always tell our clients this: you don't want to get married to the name that's on the card. You want to get married to the plan letter. So it's the same no matter what. Now, the Plan F was the old Cadillac plan. The Plan G is the new Cadillac plan, right? I got to meet that $226 deductible. The Plan N is a really good plan for some folks because it drops the premium down even lower. And historically, it has the lowest rate increases of all the Medicare supplement plans, with Plan G being the highest. Well, that's important, especially because most of the people we work with are going on a fixed income. And so the longer they can fit that in their budget for long term, the better it's going to be for them. And a lot of times I see people going with the Plan N because it fits their budget better. And the only differences are obviously lower premium. And I'm going to show you some examples of that here in just a second. But now they add a $20 copay if I go see my provider, specialist, nurse practitioner, or regular doctor. And then they could add a $50 copay if I go into the ER and I'm not admitted. Additionally, if I go back up here, remember the excess charges? That was the difference between Medicare says this is the allowed amount, that can be charged, but then it gives the doctor the right to charge 15% of that, or excuse me, what Medicare is going to pay. And then the charge that the excess charge when it comes to that 15% above that, okay? So here's the deal. The Plan N does not cover the excess charges. Once again, that very rarely happens across the country, but you do need to be aware that it could happen. Now, I want to show you a tool that we use as Medicare agents. And this is a tool that I use and a lot of agents use across the country. And I'm going to use my zip code here, my county. I'm going to say I'm 65-year-old female, non-tobacco. I'm going to apply a discount because if you're married or if you have someone 18 years old or living with you, you could qualify for an additional discount. I'm going to say non-tobacco, and we're going to look at a Plan G. Now, if you were living here in North Mississippi where I live, and once again, because I'm a broker advisor, I work with all these different companies. And a side note here, you want to be careful working with what I would call a captive agent, which means they only represent one company, because you could wind up paying hundreds of more dollars per year or over the lifetime, even thousands over the lifetime of your supplement plan, because all they represent is one company. And a lot of times I'm seeing people paying $15 to $30 higher right out of the gate. So right now where I live, it says Allstate Solutions has the lowest Plan G for $84.38. Now, if I scroll up here, and I'm going to find another big name brand company so we can look at real quickly. Okay, let me keep going. All right, so let's take a look at Cigna. I work with Cigna. Cigna's a great company, but for whatever reason in our state, their plan is almost $100, right? Exact same plan, does the exact same thing, but they're almost starting at $15 higher per month for the exact same plan. I can't caution you enough on this. I can't preach this enough, that you want to make sure you're working with a Medicare advisor broker who works with multiple companies. That way you're not paying more money for the exact same plan. Now let's look at a Plan N, because I want to show you the difference in premium. So $84.31 was the lowest Plan G with Allstate Health Solutions. Now let's take a look at a Plan N real quickly, just so you can see the price differences, because this could be the best option for you, right? As long as you're aware that there's co-pays and possible excess charges there, you want to be aware of that. But I will tell you, a lot of people are jumping on the Plan N bandwagon. Okay, so it's saying right here in our state that AARP, United Healthcare, has the lowest Plan N for $66.55. Allstate has one just for a few cents more. So if I was just comparing Allstate to Allstate, it's quite a bit of premium difference from a Plan G to a Plan N. So the question is, and that I'm trying to answer in this video, is what Medicare supplement is the best for you? Well, the bottom line is it's really just going to depend on your needs and your budget. And even if a Medicare supplement is the best fit for you, it may be the other route of a Medicare Advantage, but this is why it's very important that you sit down with a seasoned Medicare advisor that will take time to break this down for you and make sure that you get on the best plan to meet your healthcare needs. And we would love the opportunity to work with you. And so once again, the numbers on the screen are the numbers in the video description. We work in most states, so we'd be more than happy to work for you. And if we do not work in your state, we have a network of people that we work with all across the country that we can help you plug into. So once again, I pray that you got some value out of this video today. God bless you guys, and we'll see you on the next video.